In the treatment of rheumatic fever, we give kids daily doses of an antibiotic until they hit probably 18, 19 years old. Is there any justification, since PANDA could be triggered by a strep antibody, of doing something like that?
There's a lot of studies going on in that regard. And one study showed that it didn't seem to make a difference. Another study showed that it did make a difference. In my practice, I have a rule that if they have a recurrence of the symptoms, especially if the symptoms are more than mild, I offer the parents a monthly prophylaxis, or else to give an injection of penicillin once a month, or to give them daily amoxicillin, or, as was published by Dr. Swedo herself, a weekly dose of 10 per kilo of Zithromax, just to prophylax them so that...
One dose
a week. When they are exposed to strep, that this doesn't trigger the problem again.
Well, Zithromax, generally speaking, is not a drug of choice for strep, yet in these cases it seems to have some of them doing really well with it. Is that true?
It's been my experience that when it comes to PANDA behaviors, the Zithromax seems to have better control of it than any of the other antibiotics. It may not be the best drug for treating strep, so I don't really trust it. If I have a child with an active strep, I first treat it with either a penicillin or a cephalosporin to make sure that we're adequately treating the strep. And if these symptoms don't subside and the child still has the behaviors, I put them on Zithromax and I use it for a period of time till the symptoms subside, and then I taper it off. A very unconventional method for using the Zithromax, but it seems to work in PANDA behavior.
One of the theories why Zithromax could work, and say you accept it, they thought mycoplasma could play a role. Is that a possibility why Zithromax might be working?
Definitely it's a possibility. The problem with that as the basic theory is that we find with children with PANDA behaviors, particularly the kids with serious OCD, you give an adequate treatment for what would have controlled a mycoplasma infection, which is 3 days of Zithromax at 10 per kilo or 30 per kilo as a full dose, or even 5 days if you wanted to give the strep type of dose, which is 50 per kilo, 10 per kilo for 5 days. The problem is that after that 5 days, the effect that you seem to be having, that the child feels better, is acting better and doing fine, the symptoms come back as the Zithromax wears off. So we put them back on Zithromax and they feel fine. And we leave them on it for a little longer and we take it away and we put them back on Zithromax, and again the symptoms come back immediately. So we put them back on the Zithromax, leave them on it a little longer. Now this is a very unconventional way of using Zithromax, but what we eventually do is we taper the drug very slowly and the symptoms don't come back. There are some children that require several months of dosages like that. So it is for that reason that the researchers that I've spoken to think that it is not affecting it by killing the germ that's causing it, but that it has, besides its antimicrobial property, has the ability to immune modulate. And because it's having an effect on the immunity that's causing the problem, that is why when we stop it, it still isn't over with. It seems to be needed for longer. Now what I just told you is a very unconventional method, but I actually have had a lot of experience.
Are there anybody doing any research to prove these facts?
As far as I know, this particular method of managing it is not commonly being looked at.